Hello and welcome to the latest episode of the Melbourne Athletic Development Podcast. Jack,
It's been a while, John.
it's amazing that we're in the same room.
I don't know how we're coping right now.
We have had to be separated.
Many a times.
To our listeners, obviously you probably have noticed that Jack and I haven't necessarily always been on all the podcasts, so we apologise for that, but it's just been...
differences in schedules.
Yeah, it's been difficult. So
trying to get the 101 things that we're trying to get done and finding schedules and times that work for both of us.
We hope you still have been enjoying the podcasts. Obviously, we have been getting them out each week, and we've had some great guests on. So we apologise, but we hope that the quality has not diminished in that time.
Well, look, maybe we can get some feedback from our listeners of differences between you and I and think about strengths and limitations, because I think that's actually been a big learning process for us of how we actually interview people, what are the things that are actually interesting to talk about, how you get the best out of people.
Provoke them.
So I know for today, John, we were interested to talk about a paper I recently reviewed for our online learning community looking at...
Quick shout out, if you're interested, go to our website, go to professional development and sign up to our free learning community. It will cost you nothing. And
just actually give...
Poor Jack here is posting a lot of stuff. So we do have about 100 or so members, but we'd like a lot more. So make sure that you do sign up to that because there's lots of content going on there. I know that last week, Jack, you actually did a presentation on some of the work that you're doing in fascial manipulation.
Indeed.
I did a presentation this week on hamstring, which we're going to talk about, not the presentation, but some hamstring stuff today. And I'll be posting that in the next week or so as well. So
yes.
Make sure you do sign up. There's lots of free content. We talk about things and we want some discussion because I know that you mentioned probably not as much discussion as you'd like on that's more coming from our end and people not necessarily communicating on there. But feel free to communicate and post things and ask questions. You know, we always like to have things posed towards us, even if it's, for instance, a topic for the podcast that
Absolutely.
maybe we haven't addressed and people would like us to. We obviously have lots of guests and we can seek out people who potentially people would like to hear from. I
was just going to say the purpose for that learning community is for you. You know, it's for people to actually get an insight, you collectively, get an insight into stuff that we talk about. Because obviously the reason why John and I do this podcast is we obviously really like to chat and we like to connect with different people and actually get and share ideas with listeners to actually help improve the knowledge and start to spark some ideas for what we can do clinically or in a coaching scene. So the online learning community is there, which I will frequently do 10, 15-minute videos reviewing articles that we're talking about in the clinic and then thinking about its clinical implications. So it's really about trying to summarize and think about how this is relevant to what we do. And as John mentioned, we're actually doing a lot more presentations now too, of doing some live webinars, and we'll frequently record those and put them on the learning community as well. So it's there for you to actually engage with. And we're very interested to actually build a collective hive mind of actually getting people who have a similar curiosity and interest to us to actually
very
build
sinister. Are you trying to take over the world?
How's that sound, sinister, John?
Sounds like a Bond villain, hive mind.
You haven't heard of that term before?
I have heard of it, but it sounds sinister.
Oh, well, I like it.
Good. All right, let's get cracking.
Indeed. So, as I was briefly mentioning before, hamstring. So it was actually a very recent publication by, hopefully I don't butcher his name, Jan Ekstrand, I'm assuming he pronounced it.
Well, he didn't respond to us, so...
Well, maybe.
We wanted to get him on the podcast. Hopefully we can do that. He hasn't responded to us yet. He's a very busy man, I assume.
Yes. And for those of you who don't know, he's a very well-known researcher over in Europe and has done a lot of publications in hamstrings and particularly looking at hamstring injury rates in professional European football. And there was a very interesting publication he did of looking at hamstring injury rates over the last 20 seasons from 2001 to 2021. There's actually no analysis has been done in the last 8 years from 2014 to 21. And so this is obviously important to see, well, how are hamstring rates actually going? Are they going down? Are they going up? Are they consistent? And I think this is very important considering the backdrop of there is a lot of research that's been done in hamstring injuries in the last 20 years because it's one of, if not the most common injury in a lot of team sports and particularly
it is
ball
the most
sports.
common, yeah. So I think there was one, and it's from athletics, but I think it was something like 60% of all injuries are muscle strain injuries.
Yes.
Of which the highest percentage of that is hamstring injuries.
And it's interesting. So to summarize the main findings from the article, hamstring injury rates over the last 20 years have been, in fact, going up in professional European football.
Which, I know, like I sort of laugh because I think it's actually, in many ways, very telling that while we think we are getting a better understanding of what's going on, we actually haven't found the solution to that yet.
No.
It speaks to many issues, one of which is the illusion of knowledge being practically applicable.
And the perception that I think too, because I mean, nowadays we have conferences just purely based on hamstring injuries. So I think there is a perception for a lot of clinicians, coaches that, okay, we have a big knowledge base now that's obviously improving hamstring injury rates. Yet in one of, if potentially not the biggest professional sporting league in the world, in European football.
Well, yeah, this data's UEFA data, but it covers across pretty much all of the leagues that would be considered for UEFA.
Yes.
And obviously everyone knows that European football leagues are biggest, not only money generating, but also in terms of consumption. Probably actually, I lie, outside of maybe the IPL cricket, but that's heavily influenced by India's population.
Sure.
But there are, it is the biggest sport by far. And you would think that they have the resources to be able to but potentially reduce this injury burden. And it's not the case. And I think there's some confounding variables that are not related to the health professionals or the performance staff, which we can get into.
Yeah, and I think why this paper is important because it starts to make you question of, okay, what are we doing with hamstring injury management and obviously mitigating hamstring injuries? And I know there has been some arguments made that, hamstring rates may not be going down, but the intensity of the sport is increasing, which, I mean, absolutely it is. If you look at quantifiably measuring the amount of
game time,
high speed incidences, it is increasing, but actually you are seeing an increase in injury rates, at least in UEFA Football League. So that itself makes us have to take a step back and be critical of the direction that we're heading in, both from a research but also from a real world perspective about how we're doing this. Because if you look at not only the prevalence of hamstring injuries, but the amount of time missed because of hamstring injuries, it's obviously going up as well. So that has a big implication.
And with the amount of money in it, the actual cost is astronomical for time lost.
I think the other really important thing to highlight here too that I found interesting when you look at some of the data is they've collected data of looking at how many injuries occur in the different hamstring muscles. Not surprisingly, it's mainly the biceps femoris, long-headed biceps femoris. How often they occur from running versus stretching tight versus overuse. The other one actually I found very interesting, and I'll bring this up now and we can maybe talk about it now a bit later in the podcast, is looking at the amount of hamstring injuries that are structural versus functional. I thought that was actually a very interesting point as well to discuss because just to clarify what I mean by that, when we think about hamstring injuries, we typically think about a structural injury. So that is you actually have damage to the muscle tendon unit that you can see on imaging, specifically on MRI. And so when you look at the prevalence of hamstring injuries, certainly the majority of them are structural in nature. But there is a very large percentage, I think it was about 20 to 25% of hamstring injuries recorded were actually functional. So what I mean by functional is they often have, because a lot of the time 50% of the functional injuries occurred from sprinting, so they may have some type of incident, so to speak. But on MRI, there is no structural damage. There may be some edema, some swelling in the tissue, but there is no indications of structural damage. And I think that's actually another really interesting point to discuss a little bit later because that in itself is quite an interesting
What do you interpret
observation.
from that? What do you think is going on there?
Well, part of this comes to then thinking about hamstring injury classifications. So I know one that does try to attempt to look at classifying functional injuries is the Munich Consensus Statement. And they talk about different types of ones that are related to, say, like neuromuscular type problems related to the back, for instance. They also classify things like DOMS, but DOMS is very clearly a different type of classification that you wouldn't think of as a hamstring injury. But what I think that reflects is that pain, you can generate pain in the posterior thigh, i.e. in the hamstring region, from regions above or below. And I think very commonly, actually, with functional hamstring injuries, you're seeing problems that originate typically from the spine, and that could be related to either neural irritation or something even more sinister, like a nerve root impingement that can then affect the function of the hamstring or generate pain in the hamstring region, or potentially myofascial pain as well. And it was interesting, prior to me reviewing the recent article looking at hamstring injury rates in European football, I'd had a look at a study of looking at changes in the thoracolumbar fascia following hamstring injuries. So we've talked a lot about fascia. I've mentioned before the thoracolumbar fascia before as well. Most people would be familiar with the thoracolumbar fascia because it is a poneurotic tissue that you cannot avoid looking at from an anatomical perspective because it's such an important tissue that provides an origin and insertion to a lot of large muscles, including the gluteals and even through the sacrotuberous ligament, the hamstrings. But you see changes in the shear wave elastography or the stiffness of the thoracolumbar fascia following hamstring injuries as well. And the implications for that, when you're thinking about force generation or force dissipation, is an increase in stiffness of tissue may impair its ability to be able to either distribute forces through the kinetic chain or absorb forces as effectively as possible. And this is suggested to be potentially another risk factor associated with hamstring injuries because that increase in stiffness may increase the strain on the hamstring muscle itself. So this is something that I consider because when I think about functional injuries, then if you're getting changes within the thoracolumbar fascia, that may be one of potentially many changes that can then lead to increased tension in the hamstring that may then actually present clinically as a hamstring strain, even though that there isn't actually any structural damage. Or certainly it's very common for it to generate pain into the posterior thigh because of some of the myofascial connections between the thoracolumbar fascia to the posterior thigh. So that was actually a very interesting finding itself because I think that starts to make you, well, one, perhaps also appreciate sometimes when someone comes in with what you consider to be a classic hamstring strain where they've had some acute incident, yet actually make a very speedy recovery. Though that also makes me think about the importance of looking at clinical markers to get an indication of, is there clear deficits in tissue capacity?
The question that makes me, and I want your opinion on this, but the
Yeah.
question that makes me ask myself is, does that mean that we should just treat it clinically and not worry so much about the scan? Because it's become so popular now to scan things, looking for some sort of structural involvement.
And I think by extension from that, a lot of people in the medical field trying to be very predictive with the prognosis purely based off an MRI.
And the thing that it seems to indicate is, and I know that, for instance, I don't know if it's still happening, but obviously when we spoke to a colleague of ours, Brady Green, he spoke about the fact that if you look at someone like the Brisbane Lions medical team, for a long time, they actually didn't scan basically any injuries unless there was a real strong indication for that with any sort of these muscle strain, which obviously hamstring is one of. And their way of thinking of it was that they didn't believe that the structural factors found on MRI would actually change the way that they would approach the progressions. They would use much more clinical and performance information to make those decisions. And to me, it removes that idea of functional versus structural, because if you haven't scanned it, you don't know. All you're doing is treating the person in front of you.
Yeah, and look, the way I look at it is, depending on where, assuming that there is a structural lesion, and as I'm highlighting here, considering the prevalence of functional hamstring injuries that may have an acute incident is relatively high. We know that there are some things that may indicate a longer prognosis. So a good example is if you have more tendon involvement, and particularly if you have, say, the proximal conjoint tendon, the lesion is there.
I think the thing that's interesting about that, and sometimes they can be tricky because they don't necessarily present like that, but it's usually pretty obvious if it's those kind of injuries because when that occurs, it looks, feels, and behaves pretty severely.
Sure, but I'd actually also argue that if you look at some of the research that the British Athletics Injury Classification Group have done of looking at the return to sport following a conjoint tendon lesion, the range is massive.
Yeah.
When I say massive, I'm talking, I can't be very specific, so I can't remember off the top of my head, anywhere from 20 to 150 days. So although you see overall a tendency for it to increase the time to return to sport or performance, the variability is massive.
Yeah.
And so that to me also highlights again that when you think about clinical observations versus radiological findings, you have to be careful to make some preconceived ideas of how long this is going to take because the process of recovery may be a lot shorter or at the same time maybe a lot longer as well. But I think though too, that's also reflective on what kind of deficits that you see, because I think if it is a very severe problem that has a tendon involvement, you're usually going to see much larger deficits in their tissue capacity, which are with a much slower recovery, particularly in doing rate of force development stuff in particular.
I think that's the thing is like people, unless you actually have the granularity to assess these things, it doesn't necessarily come up on some of the basic clinical tests. Especially in more complex movement tasks, because obviously there's synergistic behavior that occurs with muscles around it and the antagonist and different ways in which you can kind of get around movement. You may be able to actually perform at a reasonable level, even though if you were to isolate that tissue and you started to look at it at a level of granularity, you would actually realize, it actually isn't functioning as well as what you want. And I think that's been one of the big insights that we've been able to see, particularly using more rate of force development data. That seems to really lag, especially if there's more structural involvement.
Yes.
Even though if you look at, say, their strength output, that seems to come back really quickly, even in the injuries that do have more involvement of whether it be tendon tissue or something that you would suggest is going to be really heavily involved in that creation of mechanical tension.
Yeah, and the way I see that too is even when you have structural damage, let's say it's more within the muscle or even at the musculotendinous junction, I think sometimes we underestimate how effective our bodies and our brains are at being able to alter distribution of load through the whole muscle unit. That is, i.e., change the activity or the essentially inhibit certain motor units associated with where the tissue damage is to be able to dissipate forces around it. But then
the tricky thing with that is basically it tricks you into thinking they're better than they are.
It is, but I think that's also going to your point before when you look at rate of force development, that's when it shows up more because the ability for your sensory motor system to be able to provide high force outputs at high rates whilst protecting an area becomes much more limited because it seems to be that rate of force development really impairs your body's ability to adapt and compensate for injury when you're trying to do high rates of force development is much more limited. Yeah.
We've kind of gone in a bit of a sideways direction there.
We have.
The big question is, why the hell are the injury rates going up? Like that doesn't, on the surface, doesn't make any sense. So what, I think both of us can speak to this, but what do you think is going on there? Why do you think they're going up?
Well, I'll mention something that the authors in the paper talked about first, and that is and this is more of a suggestion, that there is a lack of implementing effective injury prevention strategies into management of athletes. And
what when you say that, what do they mean by that? Were they descriptive in what they were saying, or is it just a general broad statement?
No, they refer certainly to of course, the Nordic hamstring curls, because that's obviously a very popularized exercise for mitigating hamstring injury. Though I can certainly understand and make the argument to see that there is a lack of injury prevention strategies at a sub-professional level, because there is a limitation of time, resources, personnel. I wouldn't necessarily expect to see that though at a professional level. And I mean, maybe you have differing opinions.
Yeah, like I'll speak to it at some point, but I think that's not necessarily the case.
Mhm.
Yeah, was there anything else that they referred to in that injury prevention?
Well, it's the other common one too of the differences in opinion and the management of athletes based on the coaching staff versus the sports medicine staff, because there are often can be differing philosophies on how athletes are managed and how you prioritize the multiple things that you can do in training to optimize the performance of an individual whilst trying to mitigate injury.
Yeah. All right. Well, let's start to break this down then, and let's start to think okay, do we think that that's actually the case, that these athletes aren't doing injury prevention work? And if so, why? And then I think we have to speak to, is that the key reason that they're having this problem? And I think the biggest, it's something we talk about a lot. I think the biggest thing to recognize here is, one, what causes hamstring injuries.
Well, and actually, just one thing, because this is also important to it, is particularly in European football, the schedule is so demanding.
We're getting to that.
Okay.
We're getting to that. So I think this is the key thing that you have to kind of start breaking down is, okay, one, what actually causes hamstring injuries? Now, of the research that exists, there are multiple factors that fit into, what we would consider modifiable risk factors.
Yes.
Right? And if you want to have a look at some of this stuff, obviously Brady, actually, we mentioned before, Brady Green, he did a paper in 2020 looking at some of these, difference between modifiable and non-modifiable risk factors. We won't go too much into the non-modifiable. These are things like age,
previous hamstring injuries.
We won't go into that because obviously it's not something you can change in this setting. But look at the modifiable features. One of them is obviously strength, and that's come from that research that's been done by the Hamstring Injury Group. A lot of it coming out of both Melbourne and also Queensland. Looking at eccentric hamstring strength and the implementation of these different hamstring exercises. We've seen a lot of work come out of Jörgen Gusha. We've seen work come out of Scandinavia in the past, like Carl Askling, all demonstrating, whether you use a specific exercise or not, that if people have the capability of creating high amounts of tension in that eccentric kind of fashion, they tend to have some sort of protective effect on hamstring strain. However, there are a number of other factors that do influence it, and some of them have to do with their previous exposure to high speed running,
and
the amount of training history that they have in relation to that, and what's going on with that. Factors relating to fatigue, whether that be in an acute setting or across, as you mentioned just before, multiple games across the season, multiple tournaments that they're undertaking, which is a big factor in these UEFA leagues. And then there's other features that are also, like we've spoken about, which don't always get spoken about as much, but things like flexibility have a big influence, and a big one that's starting to become really popular in the discussion, and Jurgen's done a heap of work on this, people like Johan Latte are getting onto this research as well, is discussion around running biomechanics and its influence on the overall stress that's going through that hamstring complex.
There was actually a very good paper that he published recently looking at pelvic tilt. And so that's actually something that's
their ability to retrain it, and the fact that they obviously it's theoretical that they're reducing the injury, but it's something that they feel like if they implement, it's going to start changing some of the injury risk.
Just while I'm on that note, so the recent publication that Jurgen published was looking at cadaver specimens and looking at the strain changes in the hamstring based on anterior pelvic tilt. And so what was interesting to note, not surprisingly, that as you tilt the pelvis forward, you're obviously causing the ischial tuberosity to move more posteriorly and superiorly. That increases strain in the hamstring.
Yeah.
But it was interesting to note that the increase in strain relative to the increase in pelvic tilt was exponentially larger.
Yes.
So they're actually, what he highlighted from that, and this is just purely a biomechanical analysis of the cadaver, was the change in pelvic tilt creates a non-linear and exponentially large increase in strain, and understanding that changes in strain of a muscle is the biggest predisposing factor to hamstring injury.
And so I think what us talking about all of these different factors highlights is our favorite topic, but the fact that it's multifactorial, and that means that you're dealing with a complex system or a complex driver of what the actual problem is. And when you have complex problems, trying to apply very simple or unidimensional solutions tends to fail. And one of my positions on this, I don't think it's the only factor, but one of the factors that I think is actually negatively influenced this trend is the over-indexing of the importance of maximizing strength as the factor that's going to reduce hamstring injuries. Right? And I say that not only because I think it doesn't fit the discussion that we've had multiple times, which is that, one factor will not necessarily drive a complex problem solution. And that whether you like it or not, and you can disagree with me, you'll be wrong, but that's not the way to solve a complex problem. But actually, because I've seen over and over and over with the athletes that I coach, I've got athletes who, if you measured their hamstring strength, including their eccentric strength, it's way off the charts. It's so significantly off the charts that you do measurements and you look at other athletes and you say, well, okay, there's no chance this person's ever going to strain a hamstring. But they do. And I've seen that with not only my own athletes, but other athletes. A lot of them come from sprint background. And some of them are producing as much force, like multiples of their body weight. And you go, well, okay, they're really not struggling to produce force concentrically, eccentrically, isometrically. They still end up having issues. And so I think what that highlights more than anything is if you over-index on that, you may actually be missing the fact that that problem is being driven by other features. And the research that's been done, whilst it has highlighted an important factor, it's not the only factor. And what ends up happening is you get people complaining and saying, well, they're not doing the Nordic hamstrings or whatever in these legs. And we can talk about it now because I think there's probably a couple of factors in that. Everyone thinks athletes are stupid, but they're not. We've spoken about this in regards to flexibility and stretching. Athletes will do what they believe and feel and consistently get benefit from, right? They may not be able to necessarily articulate why they feel that it works. They just know that it feels better. So if you say to athletes, you don't need to do any passive stretching, the research doesn't support it, yet you find them stretching all the time, there's a reason for it. They intrinsically feel better for doing it. And we've spoken about why they would feel better and the mechanisms behind it. And it's why we obviously advocate maybe different variable prescription of passive stretching. We don't tell people not to do passive stretching in their warm-up, right? Because the athlete will tell you if they don't feel that that's actually... And what do all athletes do, even if they only hold it for 5 seconds? Most of them will hold some sort of stretch, whether they're young kids, whether they're... And I've heard this dumb argument about this of like, oh, that's almost like a cultural, social thing that's been driven like from historical features. And it's like, no, like even people who... We've been having this discussion for 15 years. Oh, you don't need to do passive stretching. Young kids still do it. When you go down to sporting, they're doing it. You're like, why are you stretching? Feels better.
Well, and I think we can even extend this out further because, as I mentioned before in the paper, one of the things that they highlighted was, maybe we need to be doing more Nordic hamstring curls, i.e. heavy eccentric loading. So I think we can almost break it down a little bit further of going, well, there's obviously a lot of people that would argue that eccentric loading is overwhelmingly valuable.
And I don't think that we're not arguing it's not.
No. And where I'm going with this is not to suggest it isn't, but I think of, okay, what are the actual characteristics of doing a Nordic hamstring curl? Well, certainly it's a very, very difficult exercise to do. So the mechanical load that you're applying to the hamstrings
is close to maximal. Most people will fail in that task.
And so
people, you always bring this up, and I think it's such a valuable insight. How many times would you ask someone to do a task that they are at their maximal and are going to fail at, and then ask them to do that repeatedly week on week on week?
Yeah.
Right. Now, I know that because it's one isolated muscle, it's not the same as, say, a whole body task.
No, and that's where some of the limitations may come up.
But if you ask someone to do a maximal squat to a point of failure every single week, would you be surprised if the athlete was like, I don't know if I like this, and I'm pulling up really sore from it, and I feel really fatigued? Obviously, this is going to be isolated to their hamstrings. But these athletes, a lot of them don't do it because they intrinsically don't feel better for having done it. They get lots of soreness.
And this is probably, thinking about its application, even perhaps to professional football players who have a very long season. The time that you probably need to implement it is during the off season, which is usually a 5 or 6 week period, which is when they're going, mate, I'm not doing anything for the next 5 or 6 weeks.
Yeah, I'm not playing games.
No. So there's that element to it, I see, of you are actually providing a stimulus that is much greater to the muscle than what you normally do. So you are definitely going to get stronger. And that's obviously one of the benefits of eccentric versus concentric contractions, because particularly as you do it more frequently, the amount of mechanical tension you can apply to the tissue is much greater than what you can do concentrically. So I think that to me highlights that strength is a valuable thing, but it's not the only modulator to consider. The next thing I think about is you are lengthening the tissue. And this sort of comes back to your point before about stretching. It's like, what is eccentric training? Eccentric training is like the most intense stretch you can do, because you're basically saying, I want you to shorten your muscle, but the external force I'm going to apply is so strong that it's going to lengthen it. So essentially, you are causing maximal mechanical tension to the tissue. And in fact, that's why something like eccentric training is very useful for improving things like flexibility as well. It's actually one of the benefits of doing hamstring Nordic curls is it will improve your hamstring flexibility, doing like a sit and reach test. And that, I think, is also another important thing to highlight and consider. It improves your flexibility, and by extension, it shifts your length-tension relationship of where you can maximize peak force to the right, i.e. you can produce force at longer muscle lengths. That itself reduces the strain of tissue. And as I mentioned before, the biggest risk factor for any type of soft tissue injury is when you create too much strain. You can't lengthen the tissue too much. And in fact, this relationship has been shown time and again, and there's a very interesting study by, I think the main author is Wang, of looking at people with better hamstring flexibility show less strain of their hamstring during sprinting. And so this highlights to me that certainly eccentric training can be beneficial to improve flexibility and improve the length-tension relationship and reduce strain, in addition to improving strength. That's where flexibility has a role too. And I think that's important to highlight, because some people might say, well, why don't you just do hamstring eccentric loading all the time? Because you'll break someone in the process. And that's where the benefit of stretching is, amongst many other things as well. But I think that's another important characteristic. I think the other one that people also will talk a lot about with eccentric loading has to do with changes in muscle architecture. Now, that seems to be a pretty contentious topic.
I think that's super contentious, because whilst you might see those changes, I don't know that it's fully elucidated that actually is a feature that protective.
And it's actually interesting. It's something that I asked Matt Bourne about on the podcast a couple of months ago, because there are people like Tony Blazevich who have had on the podcast who would argue that that is not a feature unique to eccentric loading. And in fact, because the reality is when you do hamstring Nordic curls, you actually may see a change in that the fascicle lengths look longer. But I asked Matt this, and to which there isn't enough research of how much of that actually has to do with changes in the aponeuroses. Because the reality is when you think about doing eccentric loading, you're lengthening tissue, including the origin and insertion of the fascicles, the aponeuroses, that if you push the aponeuroses away from each other, it can make the fascicle length appear longer because it's actually stretching it. Does that actually mean that you're causing more sarcomeres in series? You're getting actual more of the contract-off units in a sequential fashion? We actually don't know. They're basing that off animal models that, when you look at how they do it, it's not really reflective of eccentric loading. But the reason why, putting that aside, when we think about, is there a benefit of increased fascicle length? Theoretically, yes, because you can obviously increase the shortening velocity. But what also increases fascicle length? Sprinting. And this is something that I think we probably need to consider too and discuss is the importance of making sure that your training stimulus provides you with the capacities you need in the sporting task.
Yeah.
And this, I think, ties into looking at training and specifically the amount of high sprinting involved in
sprinting.
training.
Yeah, well, there's a lot of evidence actually suggesting that gradual and progressive exposure to that is protective. And obviously, for me as a coach, that's the aim of the game is, can we slowly expose them to more and more of it?
Yes.
I tend to see that if once they get to a point of, what I would consider a reasonably high volume, which is more than what they're going to be exposed to in competition, they tend to be pretty healthy and not really too concerned about doing that.
Yes.
Tends to be big variations in that volume. Now, the mitigating factor that needs to come in with this is what happens with fatigue. And it's probably not an issue of fatigue within one individual game. It's the fact that if you look at a lot of these European football leagues now, they're playing club matches, cup matches, UEFA matches. It really is a really, really condensed, and it's a very long season. And part of that is financial.
Well,
there wants to be lots of games, all of these different leagues, TV. It's always going, and it goes for so long throughout the year that in itself actually starts to change what happens within that muscle tissue. Even if you've developed maximal strength properties, even if you've done a reasonable volume of high intensity sprinting, you may not actually be prepared, and or your mechanics are reasonably good. You actually may not be prepared to play 3 matches a week for 6 weeks in a row.
Well, and I was going to get to this point later, but we might as well address it now. Is I do wonder, are you setting yourself up for? Is the outcome of increased hamstring injuries actually just a bigger reflection of the fact that the intensity of their schedule and how much they play year round means that you're just going to get more hamstring injuries?
Potentially. And, I don't know if it mentions it in the paper, and I haven't looked at this myself, but how much change has happened in the schedule? Have they spoken? Did they speak?
I don't think they actually did. No,
I don't recall. So, but how much has changed in that 20 years? How many more matches are being played? My feeling is that it is significant, and that's a big factor. And teams are smart with this. They think about this. They're measuring a lot of the sort of loading factors.
Sure.
They are resting players, and if they can get away with not playing a player in a certain match because they know that they're going to win, or it's not as important, or whatever it is, they will rest players and do that. But it does seem to be a factor, because one of the problems you have is, even if the teams are doing the injury prevention work, it may drop off in periods where they're playing so close, because they're not necessarily going to say, oh, we need to get a gym session in, but they know they're playing in 2 days' time.
Yeah, and I mean, I guess it also brings into consideration how much injury prevention can you do when the schedule is that heavy anyway?
Yeah.
Because is the focus on, all right, great, you've done your, well, this is actually maybe a question for you to answer, is all right, you've done your game, now get in the gym, or are you thinking, oh, okay, we've got to play in 4 or 5 days and you've got to travel, a few hours, we're just going to focus on recovery.
And that's what ends up happening, and it's a very, very difficult balance, because you go through periods of you build them up, and then you then have to think about, okay, they're going to compete, or you want them to do well in these series of games. But if that's an extended period, that's months and months and months, you are getting this decline in their capabilities, and that's potentially where we're seeing this increasing if there's more games within the actual calendar schedule. And I think that that's a really big factor that isn't necessarily being accounted for when they say, well, people aren't doing the injury prevention.
And going back to the point before, we're talking about training, we're talking about sprint volume and preparing athletes for competition, is when in the Eccentric study, they talk about when do hamstring injuries happen? And not surprisingly, they happen towards the end of the game predominantly. You do see them earlier on, but overwhelmingly it's in the second half and even towards the end of the game. And I think that's the other thing to consider is, do they have the metabolic capacity to be able to maintain a high output without losing either the mechanics of how they move? Because we obviously know fatigue is a big factor for how you move as you get more tired. And then I also think of it even at a tissue level too, of are you able to maintain the same behavior of the muscle tendon unit that mitigates strain through areas of the muscle that are predisposed to
Yeah,
injury.
I spoke about some of this in the chat that I had the other night, looking at hamstring injuries in high-speed running, because the thing that's really clear, and even some of the data that we collected with our athletes, and it's funny to say this because we almost cursed ourselves, it seemed. We started using some inertial moment units with some of our athletes in training and in racing. And we actually ended up having those athletes get injured while they were wearing the units. So we actually have really interesting data looking at what happens in the difference. One of the key things that seems to be the case is there tends to be quite a significant change in their, rested healthy data versus fatigue data in relation to the amount of vertical moment, like forces that they can create.
Okay.
And what that suggests is like when people are getting into their upright phase, as they're getting more fatigued, they can't actually apply the same vertical forces.
Yes.
And to me, what that suggests is people will try and find a solution, as we said about it at the start. So what they try and do is they try and create horizontal momentum once you're already in a position where most of your orientation is vertical. Your tissue doesn't really want to do that. Your body doesn't.
Well, the thing
if you look at let me finish this point because
on.
then you can bring up your point. If you look at and this is where you have to start thinking and understanding functional anatomy. If you look, overwhelmingly, muscle tissue is aligned in the sagittal plane, and it's overwhelmingly aligned to create vertical forces against gravity. And we know why that is obviously our tissue responds to the stresses placed upon it. Now, there are some muscles that are orientated obliquely, and they have rotation capabilities, and they have the ability to act across planes. And it's not that we don't act across planes, we do. But if you overwhelmingly, I don't know what the percentage is, but it's mostly aligned so that your tissue acts vertically. And for that reason, the only way you can actually create a lot of horizontal propulsion is by reorientating your entire body. And that's why you see people, leaning forward when they accelerate. So what ends up happening, and that's how you start to create horizontal momentum. When you've actually attained horizontal velocity and momentum and you've finished accelerating, you're not getting any faster. You're trying then to maintain that. So the vast, vast, vast majority of your forces are going to be orientated vertically. What you tend to find is, and this is a theory that I'm working from, but where I see a lot of hamstring injuries seem to occur is either when someone has the wrong idea about what they should be doing when they're actually in the upright phase of high velocity sprinting, which is they think that they should be trying to create horizontal forces. And one of the areas that's going to be highly stressed when you do that is your hamstring, because it's trying to create extension of your hip. And the way you do that is kind of by reaching and overstriding and then trying to really pull back. Or you become so fatigued that you can't create the vertical forces and you try and find a solution to that. Right? So either they're trying to do the wrong thing from the start, or they get tired and then they can't really do the thing that they want to do. But it still leads to the same thing. They're trying to create horizontal momentum and therefore horizontal force application in tissue that is aligned in a direction, especially with your orientation body now being upright. It's really not designed to do that.
Yes.
And that's when they actually strain something. And I spoke about it in relation to track and field. I think the people who get injured are often doing so because their race model is wrong. They stand up straight away and then just start sprinting. And then they keep having hamstring injuries. Like, because you don't develop your velocity in the acceleration phase. You're trying to develop it in the wrong kind of phase. And you end up straining your hamstring because you're trying to use it for what it's not really designed to do, or it's not doesn't have a lot of capacity to do.
So there's two things I think of, and one of them actually then is too, when I think of in team ball sports, it's very difficult, particularly if you have the ball, to actually stay in a horizontal position. You want to stay much more vertical because you have much better ability to be able to control the ball, not to mention obviously observe your surroundings.
Yeah, exactly.
So I think that actually fits in with what you're saying, because in reality they probably need to ideally spend more time in a horizontal position, but actually transition to a vertical position, but still trying to create much more horizontal propulsion because they haven't reached their max velocity.
And one of the things we see a lot with field sport athletes is most of them don't know how to run in an upright position. They do what I would consider like a modified acceleration position. And it's because most of their running is acceleration.
Yes.
They don't actually ever get taught to transition into an upright position, right? Because they don't do that much of it. They like in some sports you do a lot of it, but in a lot of sports you may not. A lot of the time it's just 15, 20 meters is the maximum acceleration you do. So when they get into the position where they do have to do it, they actually haven't practiced it.
Yep.
Especially if it's then under fatigue, it just worsens the situation. So one of the ideas that I believe potentially is influencing this is the fact that they may actually not have a lot of practice in the right positions.
Yes.
When I say position, technical and biomechanical positions to develop the features that mean that under fatigue they can still replicate that.
Yeah.
And when we mentioned Jurgen before, but you look at most field sport athletes and they all run with huge amount of anterior pelvic tilt, right? They run with quite a posteriorly cycle.
Yep.
We talk about like backside mechanics. And the reason is because in the acceleration, some of those features may be useful. Now, I'm not saying the ideal way to do it, but you can get away with it in that position because you're orientated with your torso in a way in which it actually should help you create some horizontal momentum. Gravity is pushing you forward if you're leaning forward. However, once you get up, that doesn't help you. It actually slows you down because you'll end up landing ahead of yourself and creating sort of some braking forces.
Yeah. Well, actually, the other thing I was going to mention too, this is just something that I think from a simplistic standpoint, you're mentioning about seeing a big reduction in vertical displacement or vertical force production.
Yeah, vertical moments, yeah.
Vertical moments. Is under fatigue, is that also just a reflection of your body going, well, for me to produce vertical forces is much harder because I'm directly perpendicular to gravity as opposed to if I'm pushing horizontally, I can produce, if I can produce a similar amount of force, I'm going, I'm perpendicular to gravity when you're horizontal as opposed to fighting against it by doing vertical forces. Is that actually your body's way of almost trying to conserve energy by going, I'm not going to fight gravity, I'm going to try and work against it?
Totally. And there are theories around that. There are, particularly like if you look at how some athletes run, and it's very noticeable, for instance, the conservation of momentum can be increased by doing that. And you see that with middle distance and distance running. Even if you look at 400, the propensity for them to have more of a forward lean is much greater than the 100 and 200 meters.
Okay.
And the reason that is the case is, as you said, they're trying to conserve momentum. It's not that it's wrong. In fact, it actually can be very useful.
Yes.
I wouldn't say get away with it, but it is possible because the forces that you're creating when you're doing that are not anywhere near what you would be doing in, say, a maximal sprint. Even if you look at, and the 400 is probably the borderline.
Yeah.
But if you do like an 800 meters, it's nowhere near maximal velocity.
Do you, just actually out of interest, because I'm just thinking this through in my head, do you see a higher prevalence of hamstring injuries in more 1-200 events versus a 400, or you're not sure?
You still see a fair few hamstring injuries in the 400 as well.
Because the way I look at it, I'm just thinking about it now, of 400, you are pretty close to your max speed for that event, but that change in biomechanical position, what's the trade-off? Because you are actually making yourself conserve more energy, but you obviously are changing your pelvic tilt and increasing strain in your hamstring.
Well, this is the thing, you don't necessarily have to increase your pelvic tilt.
Yeah, okay.
Because really your pelvis, and this is the trick, is even in the acceleration, your pelvis should be neutral. Right? You essentially want, for those watching on the screen, you can see my hand. If you're in this orientation, your pelvis shouldn't be tipped at the front. It should literally be in alignment with that. And so as you come up, it does the same thing. It's not that this is here, it's there, and it comes up into position as you transition into the upright position. So
it makes sense because you obviously need to get a lot of hip flexion in the acceleration phase.
Exactly.
As well.
You want that to be neutral. You don't want that to be anteriorly tilted because, as you said, that'll even reduce how much hip flexion you get. And if you have less hip flexion, it means you've got less distance and torque to be able to create from, the hip and the knee to be able to smash into the ground, put forces into the surface. So it's one of those things that a lot of people get wrong, is they want to, as you said, use that falling position and concomitantly that anterior pelvic tilt to cheat their way into more, like less fatigue resistance. But it can be a dangerous game if you're not able to control it. And the question you asked about the four is you don't see as many injuries, but you still do see them. I would say the thing that protects is it's really not anywhere near as maximal.
No.
Right?
No.
If you ask any 400-meter runner, they're nowhere near their maximum velocity when they're running in those races. Now, some people may push that and get quite close to it, the really, really elite ones, but the vast, vast majority of people are doing that not. I would say, the highest percentage is around that sort of 98 or 99%. And people think, oh, that's pretty high. But if you actually look at it in terms of time and you calculate it, that's actually quite a difference in the velocity that they're moving at.
Yeah, there's something to be said about that actually too, of the small percentile change and how much it actually affects the intensity and speed of movement. I think it's probably something that's perhaps underestimated.
Well, I think it's interesting because I have this discussion a lot with even other coaches about the different, and because you have to educate the athletes, the difference between effort and the actual velocity that they're moving at. So when I program, I will program off velocities.
Yes.
So if I say, okay, this is at 90%, it's 90% velocity, not 90% effort. When you get around to that 90%, sometimes it actually feels similar, but there's a really big error that often occurs. Say if you would like someone to run slower, say like they're coming back from an injury and you say, oh, I want this at 70% of the velocity. It's not the same as feeling like 70% effort. Often it might only feel like 50% effort. And so they end up going a lot faster than what you actually should be going. And obviously what you need to do is work out what is someone's maximal velocity. And you can do that either using, GPS data, or you can do it, using, race data that they might have, or even the time. There are a lot of tables that will give you an idea of what their maximal velocity is. Calculating what that maximal velocity is. So as an example, if someone runs, their top speed is 10 meters per second, that's 36 kilometers per hour. And, you take that off the GPS. If you say, oh, okay, I want this at 70% of the velocity, that's only 7 meters per second, which is a lot slower. And a lot of athletes won't be able to wrap their head around the fact that that doesn't feel like 70% effort. It often feels a lot slower than that. And that's part of the progressions. Because that can be a major factor for when you see injuries, is people are actually not sticking to the prescribed, intensity.
To bring this full circle, thinking about what sparked this conversation about actually seeing an increased injury rate in European football. What do you think then? Like, what do you think you take away from this conversation, and how do you see why do we see these results, and what are the limitations with how we're approaching injury prevention at the moment?
I think the big thing is we need to see it as a complex problem, and we need to make sure that we're probably, because I don't see that at the moment we even have a way of quantifying this, but it should be relatively equally weighted across the areas. And I don't know that that's necessarily happening. I think that there might be 6 or 7 factors that are the main modulators, and probably over skewing and over indexing on maybe 1 or 2, and then getting really annoyed that it's not happening. And even if people aren't, it's not the right position to take, of like they don't actually even do that task. Like they're not doing eccentric loading. It's like, well, you're taking a risk there. I think the way that you attack it is you need to make sure that you've got some understanding or implementation of a strategy for each of those areas. And overall, that's going to lead to that system being more resilient when it comes to being exposed to lots of high-speed running. But if you haven't addressed all of them, you're probably leaving yourself open to that. So, and as we said, there's multiple factors of not only is it intra, but it's, like inter-competition fatigue that you need to be measuring. And as you mentioned, like sometimes people go, oh, well, that's just about maximal velocity exposure. And no, it's actually a lot of it probably how metabolically conditioned they are. If they've already done 60 sprints and change of directions, and they've had the ball, and then they've got to concentrate. And what happens then? Then they need to be able to the sprint, and that's when you need to implement it. And this is not a criticism in any way of the professionals who work in these, because I'm sure they are much better than I would ever be at being able to prepare a football team. So it's not that I don't think they're doing it. I just think that what we need to see is a significant utilization of all of the areas.
Yes.
And I think that there can be a major problem. And I think this is where the strength thing, to me, has been a negative. Weirdly, I actually think this eccentric stuff has probably been almost a negative with the research. Is it's caused a significant over-indexing of that as being the central and most important modulator. And I don't think that it should be weighted in that way as being more than the other factors. Is it a significant factor? Yeah, it's probably up there, right? But I don't think it's the only factor. And I think what's happened is it's put too much emphasis on that. And that actually in itself can be a problem. Because one of the things that we haven't really spoken about is, but we mentioned it when we said it's a maximal exercise, is what is the residual fatigue of doing a maximal task and then going into a competition?
And
like, I'm sorry, just
go on.
Finish the point you can say. Right. I'm so acutely aware of that when I coach my athletes. For instance, the last very significant hamstring loading that we will do is probably 10 days before a significant competition.
Yeah.
Right. And most of the time it's about 7 days out that I'm still happy to play. But if you're playing every 3 days, where do you put that?
Well, and I was actually just going to mention, I think that's perhaps a limitation for academics or researchers criticizing, sorry, let me say that again. I think that's perhaps a criticism for academics or researchers suggesting that something like Nordic hamstring exercise is not done enough, not understanding that it's not necessarily something that coaches, clinicians probably haven't thought about implementing.
Oh,
it's
of course,
about
I'm sure they're thinking about it all the time.
Completely, but actually implementing it in an effective and safe way, because popping it in mid-season going, all right, we're going to get you stronger, or after a game, maybe actually one of the worst things that you could do in terms of causing severe soreness and delaying their recovery.
I think you brought up a really interesting point, and we'll talk about this now because it's something we haven't, but you brought up an awesome point earlier, which was when you implement this stuff, it needs to be something that's done at a time where the competition stress is not there. And you need to then keep that going through the period in which you're actually doing, like your competition schedule has started. Because if it drops off, the gradient that your body perceives is one in which it needs to down-regulate everything. So one of the things that I try and work on a lot, and this is a periodization kind of discussion. I spend a lot of time starting to implement the training and the intensities of the tasks that I would like, and actually growing the volume of that over time, And I think it's one of the things that we have been influenced by, say, more traditional models, is there's a bigger volume at a lower intensity at the start, and then it peters down, right? And we increase the amount of volume of high intensity competition. But we're not necessarily doing a lot to support that because we see that as the main stimulus. And I think that we see a lot of deconditioning of athletes through the actual season when we should be maintaining that. And that can be a factor for why we see injuries start to pop up, because the athlete becomes less prepared to be able to do the game, even though they're playing lots of games. It's not enough to not do any training. And I think that's a factor that influences them. One of the other key features, which I'll bring up, and I'll probably get yelled at by people who are in these professional sports, but I actually really think that a lot of professional sports, and I think soccer can be one of the worst for this, is there is a lot of star fucking going on. The better players, unless they have a propensity to be that hard worker, often get away with doing whatever they want. They know that the game is heavily skill-based, and they can play at a really high level without actually having to do the training or to do the hard physical training. They can still be very, very useful in terms of their output in the game. So they basically push their way around and say, I'm not doing that. I'm not doing the hard stuff. I'm doing the easy tasks. And I'm going to avoid doing the hard training.
Mm-hmm.
And people say, "Oh, bullshit! That doesn't happen now." Like it happens.
Yeah.
It's
No,
really
well,
clear.
I'd say
And
I've heard from people that know that exact phenomenon.
I can't speak exactly to European football,
No.
right? I have heard stories, but they're not firsthand. But firsthand, I have heard from people working in professional organizations in Australia, both men and women, who say that sometimes the better players choose not to do things and they actually have the position within the organization to opt out.
Mm.
And not only is, I think, psychologically is that a bad thing for the other team members, but it means that they're underpreparing for what they're doing. And a lot of them may get away with it because their contribution to the team isn't diminished, but potentially their injury risk goes up. And soccer in itself, it's like a number of other sports. They have this weird concept in their mind. And one of our colleagues, who we've known for a long time that's worked in soccer in Australia, said, like, there's still these overriding sentiments, particularly from European football, that everything should be done on the ball. So the idea of doing external running or other tasks is almost not in their vocabulary. It's like all the conditioning happens on the ball.
Well, and just on that note, and actually from another paper published by Jan Ekstrand a couple of years ago, was looking at perceptions of coaches, sports medicine staff in European football, of what they see to be the biggest factors that are important for mitigating injury. And actually, one of the big ones was not necessarily related to looking at things like tissue capacity and what you're doing outside of field training, but even just the relationship and trust between coaches and the sports medicine team.
Yeah, it's huge, isn't it?
It is, and it speaks to your point here, because if you as a say a strength and conditioning coach, high performance coach, in the sports medicine team, and wanting to implement certain practices, and you have the support of the coach, then you know that you're going to be able to stand up to players going, "I'm not going to do that." It's like, well, guess what? It's actually a part of what we do now. Yeah. And if you want to be a part of this team, this is what you have to do. You overcome that barrier, as opposed to having to pamper to the demands of individual players if there is that culture where they can do what they want.
There is a lot of pressure too, and this is one of the things that I do not envy about colleagues we have that work in professional sport, is there is a lot of pressure because of money to not get the better players injured. We spoke about this in one of our team meetings, the situation that's going on in one of the AFL teams, the high performance managers leaving, and people, were really, it's a big club in Melbourne, and the supporters were getting all upset because the injury list was growing and growing. And it's heavily influenced their performance throughout the season in a negative fashion. And then people started digging up podcasts and previous discussions where this high performance managers was talking about their philosophy and the idea of, in the preseason, you really got to push. And if people get injured, it's almost a bit of the price you pay for trying to develop the underlying capacities. Now, that obviously requires a lot of trust from, as you said, the coaching staff, of their performance staff, and the players buying into that. It's really something that, unless you've got that collaboration, it's not going to work. And a lot of people see that approach is not the right approach, but a fundamental reason for doing it, I think, is sound.
Yeah, and I would think the other thing that highlights too is you have to maintain that to some level throughout the season, because most professional sports, the season goes on for 4, 5, 6 months.
8 months, yeah.
In European football, it's 10 months.
Yeah.
So you actually have to maintain a certain standard of training and certain types of stresses to maintain certain capacities, because if you don't, then you're also going to run into some injuries even if you have the best preseason possible.
I think we've addressed most of the issues there. Is there anything that you wanted to go on with further with why you think maybe the hamstring the hamstring injury rates are still growing?
To be honest, I actually think it's one of the big things, is something that you've already mentioned as well, and I actually think it needs to be highlighted, is thinking about the actual philosophy or framework we use. And
we use linear models still too often, and it's I think the major reason why hamstring injuries are not going down.
It's actually, I think I briefly mentioned this to you. For our listeners, I interviewed Judd Kolkoven a few weeks back, and you and I have talked a lot about Judd's research work. And reading some of Judd's work sometimes can be quite challenging because it's very intellectual, it's very academic. But it was an interesting question when I asked him. I said, do you sometimes think you might get a bit too caught up in the weeds here? Is it getting too academic and intellectual? And he goes, I understand a lot of people think that, but he goes, I'm trying to essentially shift how we do research within sports medicine. And part of it is about having a theoretical framework to begin with. Because, how he looks at injury models very much aligns with how we are trying to approach it, and understanding that the current method of being very linear, being very controlled, is not reflective of how injuries occur.
What the reality of it is, yeah.
And I think that itself is actually something that needs to be considered a lot more by all parties involved. Part of the issue I think we have at the moment is we still jump too much from, we need to focus on this, we need to focus on that. The reality is, as we've talked about, is you kind of need to focus on all of it, and how much you focus on each element.
I will say, because obviously we have listeners who may be earlier on in their clinical kind of journey, and or health or professionals working in sport. And when you say that, like, it's difficult for them to be able to assess and implement something. So the thing I would say is, if you need to steal, rob, copy a program, it's not an issue.
No.
What you need to then do is, if you find that it's effective, you need to spend the time working out what aspects it's addressing, so that you start to understand why it's effective, right? Because then once you've got that knowledge, you can build on it and you can start to go off script a little bit, and you'll be able to assess things and see things in a way that gives you the opportunity to navigate the landscape of what's happening with the individual that you're dealing with in front of you.
And to extend on that too, because I guess in many ways we do have kind of perhaps protocols we follow, but as you learn more, you realize, okay, there's a limitation. This doesn't actually look at
address this or
enough eccentric loading or metabolic conditioning, and actually realizing that there are things you need to continue to implement and increase in what you do prescribe or what you do assess.
All right, thank you so much for joining us, listeners. Obviously, this has been on hamstring injuries, and for anyone who is interested, I will be doing a presentation and workshop in person from Melbourne Athletic Development in Melbourne, obviously, in our clinic in Abbotsford on November 3rd, which is a Sunday. So if people are interested and you've made it to this point of the podcast and you do want to learn more about managing hamstring injuries, and in particular my slant towards addressing some of the biomechanical features, details of that workshop will be going up onto our website.
And obviously I'll certainly share on our social media. I'll certainly share it on our online learning community. So a shout out to join that. Again, it is free. And actually one other thing I'd also mention, I always do like to mention, is please do like, subscribe, comment on our podcast on whatever platform that you watch it. It does really help us a lot to be able to increase our reach. This is something that John and I love doing, and we want to be able to share all information and ideas that we have, and obviously share information with our guests. And it really helps to increase our reach by liking, subscribing, commenting. So please do.